So in order to achieve universal health coverage, we need the participation of both the public and the private health sector. However, the private health sector in Zambia faces a lot of challenges. I'll mention three most important challenges. So the first one is regulation, and double dual regulation. So we find that for health facilities, there's multiple licensing, maybe about 13 licenses in order to operate, for example, a Class A health facility. It's important that moving forward, and this is what we are advocating, to reduce those licenses, and sometimes there's duplication of efforts. If application can be done with one organization, let's say HPCZ, and we know that when the payment is made, it's made to the government, and then the other interested authorities and organizations can take part in the inspection and then share the resources accordingly. That will improve efficiency, improve the timelines, and people can be served better. When it comes to financing also, one of the major challenges in the private health sector, you see that most of these facilities are medium and lower level, medium and low level facilities. So there's no specific funding that is tailored to the health sector in Zambia, mostly because it is classified as a social sector instead of an economic sector. So we are advocating that it's moved, the health sector is moved to an economic sector where it will be able to contribute significantly to job creation and also to offer quality jobs. So just like there are some loans and financing packages that are tailored according to the manufacturing industry, according to the hospitality industry, according to agriculture, there should be some packages also for the health sector. But also there's a challenge in terms of payments for insured services, both public and private insurance players. That also affects the operations and the efficiency of the private players. The last one, which is very, very important, in fact the most important, is collaboration between the public sector and the private sector. Currently there is a disconnect between the public sector players and the private sector players, when in fact the private sector is supposed to complement and fill in where the government is lacking, and vice versa. So there should be referrals from the public sector to the private sector, and from the private sector to the public sector for the benefit of the patient. So the private sector needs a voice within the Ministry of Health, more or less a responsible office or person for easy communication. But also we need a technical working group to be set up. That will be a high-level decision-making group that will be co-chaired by the Ministry of Health and the private sector. In that way, dialogue, meaningful dialogues can be made, and key decisions made that will improve the health sector in general for the benefit of the Zambian people.